Ghana's medical oxygen ecosystem. The United States remains committed to providing this kind of life-saving support for Ghanaians. These oxygen plants will serve patients across Ghana, as was already noted, from newborns and mothers facing life-threatening breathing complications to patients battling respiratory illnesses. I was in Tamale last year and visited the site of a oxygen-providing facility that we had donated during COVID, as it was mentioned. This was when we really emphasized this. And I toured the NICU there, the neonatal intensive care unit, and I have children, although they're teenagers now, and when our daughter was born, there were some complications that we were worried about, so that was the last time before that I had been in a NICU. And truly astonishing to see what was certainly the smallest human being I've ever seen in my life, a prematurely born young boy, who the doctor there said that he was slightly smaller than the smallest child they had ever been able to save. So it was a question of whether or not he was going to live, but the oxygen present at the hospital that we had provided the plant for a few years earlier had given him a chance. And so it's really a tremendous honor for us to be a part of something that so directly relates to life and death and can give life. At the height of the pandemic was when the need for oxygen was most urgent, as I think we all saw everywhere in the world. We supported the ministry and the Ghana Health Service at that time to install 5 pressure swing adsorption plants, PSA plants. We also provided at that time 50 ventilators and 28 high-flow oxygen concentrators to facilities across Ghana's 16 regions. We worked hand in hand with Ghana's National Case Management Team to train 1,500 health workers in oxygen therapy and the management of critical cases. That training began at Ghana's prestigious Infectious Disease Center here in Accra and cascaded to hospitals across the country. Not only did this investment of millions of dollars save lives during the pandemic, it helped to transform the great work being done in Ghana's healthcare landscape. With today's donation of the first of these 10 liquid plants from the U.S., over 155,000 patients every year will have access to life-saving medical oxygen, which constitutes about 30% of Ghana's total medical oxygen demand. These efforts have laid the groundwork for others to help join the effort: the Global Fund, the World Bank, UNICEF, and other private sector partners. Public health emergencies, as awful as they can be, are also often opportunities for advancement. And that was shown through the critical partnerships that we participated in during an unprecedented pandemic a few years ago. The United States will continue to be a key bilateral partner of Ghana's going forward, supporting the government's move to greater self-reliance. While the U.S. is committed to supply 1 year's worth of liquid oxygen refills to these 10 facilities, the Ghana Health Service will lead operations by training the next generation of biomedical engineers and maintaining the plants to ensure that the long-lasting, life-saving systems remain securely in place. We will continue to work closely with the government to advance our joint global health security priorities to prevent, detect, and respond to current and future infectious disease outbreaks. Select development programs will continue under the State Department going forward, including about $40 million in health, education, and agriculture support. These programs include life-saving health activities such as maternal and child health, HIV/AIDS, malaria prevention, and continued support for a school feeding program targeted at low-cost private schools in northern communities. The United States seeks to remain a reliable partner in collaboration with the government of Ghana. But the United States has broadened our interest in the region beyond aid, investing in countries like Ghana by investing in commercial diplomacy. Ghana has the potential to take control of its own healthcare system by partnering with innovative American companies like Zipline, whose drones have delivered life-saving medicine, vaccinations, and blood to over 500 healthcare facilities in Ghana. This commercial partnership is transforming how technology can improve healthcare while creating economic opportunities within Ghana for the people of Ghana. American companies can bring the best innovation in the world, but also training, jobs, and community investment. The healthcare community on the ground in Ghana is doing the real work, real hard work of saving lives. And it is really to you all who I want to dedicate this to. The future in Ghana looks brighter when all of you are able to work closely in cohesion. I would like to acknowledge the Ghana Health Service, the LECMA leadership team, the technical expertise and collaboration of JPIGO, all of the doctors and nurses who do that hard work every day of providing care to patients in need. In reality, what we are doing today is putting this tremendously important resource of medical grade oxygen in your hands to provide the care that you see that is necessary. And so we thank you, I thank you for all of your work on that going forward. Together, we are helping to build a stronger, more reliable healthcare system for Ghana, one that will save lives today, tomorrow, and for generations to come. We seek to ensure that no mother, no newborn, no patient is left without access to the oxygen that they need to survive. And we will ensure that the investments the United States makes in Ghana are sustainable and rely on the Ghanaian people to maintain those frameworks into the future. Thank you very, very much.